We are all doing it, no exceptions. We're getting older every minute, every day. We're going to talk about the problems of aging next, right here on Due Process.
Major funding for Due Process is provided by Meade Lexus of Southfield and Meade Lexus of Lakeside, offering a large selection of new and pre-owned certified premium vehicles.
Someday, your life will flash before your eyes. Make it worth watching. Introducing the 2013 Lexus LS, an entirely new pursuit.
And by WWJ News Radio 950, keeping you up to date with the latest news, traffic, weather, sports, and business information 24 hours a day, 7 days a week. Live, local, and committed to Michigan's future. News Radio 950, WWJ.
Thank you. I'm Henry Baskin. I'm your host for this edition of Due Process. Today we're going to talk to two people who are intrinsically involved in the aging process and the problems and the treatment and the cures, if any, that it presents. With us today on my short left here is Dr. Gwendolyn Graddy-Dansby.
Yes.
Okay. Welcome to Due Process.
Thank you.
And Lynn Alexander. Thank you so much for being here. Let's talk about a problem that we're all experiencing, whether the people we know, whether the families we know, they're all trying to deal with aging and aging problems. Our population is getting older, much, much, much older.
Yes.
We have people on a registry who are 100 years old, and you can go online and find out. Tell me about your facility.
Okay. The Center for Senior Independence is a PACE model program. Now, PACE stands for Program of All-Inclusive Care of the Elderly. It was a program developed to be able to provide a comprehensive overview, comprehensive treatment, and integration of treatment for a frail elderly population. When we talk about people aging, we also recognize that as people age, there are some unique challenges. And often one of the unique challenges is, where can we take care of them? Can we keep them at home safely? And what does it take to do that? What this program does is it identifies a frail elderly population that are nursing home eligible but safe to remain in the community.
Is there an age, a starting age?
Yes. The age is 55 years or older. The average age for most participants in PACE programs are about 86. Okay. And the Center for Senior Independence, our program here in Detroit, is 86. Okay. So there is an age requirement.
Lynn, tell us about your program.
Yes, well, as you know, I'm with Presbyterian Villages of Michigan, and we're actually partners with the Center for Senior Independence on the Detroit riverfront. And we have a new continuing care retirement community, essentially, that's the first of its kind in the country, because it starts with the PACE program, goes all the way through to state-of-the-art nursing home care, independent living, and assisted living, and will be part of the Riverfront Revival in downtown Detroit.
Well, how does this work then? Your patients or your customers, your clients, your people are treated over at PACE?
Well, actually, we do have some residents right now at our Redford location and others that are their clients, but we're partners. The Center for Senior Independence, United Methodist Retirement Communities, and Presbyterian Villages of Michigan have all joined forces to create this community on the riverfront called Rivertown.
Okay, this is about maintenance and care. This is not about the cure, because
Correct.
Your people are, there is no magic bullet, there's no pill that is going to stop people with cognitive disabilities and dementia or Alzheimer's.
Or with aging. So we're not looking for a cure for the aging process. We're looking for how can we make certain that the quality of life is good for a person who's aging.
And you're looking at me. Give me some advice, will you please?
Well, probably some of the things you're already doing. Number one, it's extremely important to make certain that whatever health conditions there are, that you're being followed by a primary provider. So you need to see a primary care provider, make certain that those chronic diseases that many people have as they age, including hypertension and diabetes and elevated cholesterol, that they're being treated and monitored. The next thing is we have to make certain that we look at lifestyle. As people get older, there's been the term you can't teach an old dog new tricks?
Correct.
I think
But
that
you
you
think you
probably
can.
can. Yeah,
Okay.
I think you can.
Well, then, your people
you can.
are they inpatient, so to speak?
We have the whole continuum from total independent living all the way through to nursing home
So-
care at various locations.
So it's the same as PACE. In other words, do you try to have your people be able to be comfortable in their homes?
Absolutely, and that's what people want more than ever. They'd like to stay in their own home. And as you mentioned, the population is aging so quickly.
Oh,
we won't have enough nursing homes or assisted living facilities anyway. You brought up a great point about aging is inevitable, but as our doctor pointed out, it's what we do with it, and we can age well. Presbyterian Villages has a number of wellness programs.
Yeah, aging well. I've heard that expression, and you know, people should be able to understand how to age well. And I don't know if there's programs that teach it or insist on it, or it's the criteria that you use before you take a patient in. You have Medicare and Medicaid, correct?
That's right.
Does Presbyterian Village, do they have Medicare and Medicaid?
At various locations, we can handle both.
You can handle both.
Yes.
There's no private pay then
We have private pay as well.
for inpatient?
Yes.
Okay.
Yeah.
But you don't have private pay.
No, the way the program is set up is the participants who come into our program are dually funded, so they're eligible for Medicare and Medicaid. Medicare and Medicaid give us money to be able to provide all of the services, so there should be no out-of-the-pocket expenses for these participants. They don't have to pay co-pays for their medications. They don't have to pay co-pays for doctor's visits, but the medication, the monies that we receive cover all of their services.
And probably not enough. But
Well, yeah. What you have to, one of the things that we've learned, and this is through experience, is that quality health care is not more expensive. If you do it right the first time, you're less likely to have some of the complications and side effects that you may otherwise have. So if we do it correct, if we have care plans, if we have plans on how we're going to provide the care, if we monitor our participants, which is another benefit of our program, we can monitor them, we can see them as often as they need to be seen, it's enough to take care of them.
so Lynn, if your people need care, you'll use PACE. You'll send them over.
Yes, and we'll be partners with them in the initiative in Detroit. And PACE is a little bit different than, say, nursing home care because it's adult daycare. So in many respects, it's part of our new way of providing care. There are a lot of two-career couples today. Back when my parents were caregivers, it was mostly one-career households.
Right.
Now today, there are a lot of people who want to help take care of their parents, but they have two careers, so they can go and get stimulated throughout the day, have wellness programs, have the checkups that we were talking about, and really it's by having those choices, it keeps people aging well, prevents rehospitalizations.
Absolutely.
I'm sort of
And premature nursing home admissions,
Yeah,
because that's one of the things, too.
The most important thing to me and my friends who are dealing with aging parents is that the parents want to be in their home.
Yes.
Absolutely.
They want to stay there, and sometimes that requires a huge expense of care givers being paid by the hour and working in someone's home.
Yes.
That's not realistic. But what we're facing in this country, that's not realistic. I don't think that can go on forever. What you people are doing is helping the quality of life for these people. You're not going to cure dementia. No. You're not going to cure that syndrome. You're not going to cure Alzheimer's, although we were talking, the doctor and I were talking, Eli Lilly announced that they had a pill for dementia or Alzheimer's, one of the two. I heard that this morning. That's probably a long way off and not worthy of discussion. The point is, though, the age 55 sort of troubles me. I mean, you're saying that's the entry point for your clinic?
Yes,
is that
for our
your
program.
entry point?
For some folks.
Your program.
For some folks, but mostly they're 62 and above, and most of the clients, as we pointed out, are in their 80s.
Absolutely.
Most people prevent having to do these kinds of things. But I want to readdress, too, what you were talking about, curing things. We've had situations where people had so many chronic conditions they could barely breathe well or walk, and getting into a wellness program, they now can walk to facilities or walk to the Tigers game.
Really?
We have an Olympics every spring, and all year long our seniors train for that Olympics. It's really wonderful. So we've made wellness and exercise and activity a fun thing to do, something where you belong to a group and provide that socialization. So you can have dramatic turnarounds.
Are there enough medical personnel, enough doctors, enough trained, skilled nurses that deal with geriatrics in our state?
What we're looking at is probably in the next 5 to 10 years, there will be a shortage of physicians, primary care physicians, and primary care physicians are usually the physicians that take care of the geriatric population. But there'll be a shortage in primary care physicians, there'll be a shortage in physicians that specialize in geriatrics, there'll be a shortage in nurses that specialize in geriatrics. So every health care field that you look at, there will be deficiencies because people are going to retire and people are not going to be going into health care. So we are going to have a shortage, and that's going to be pretty significant.
We boomers have created a lot of this situation with the aging of the population increasing so dramatically.
Well, because of better living, healthier living.
too,
I mean,
yeah.
For the most part, and we can treat things and cure things now that we couldn't before. But I wanted to go back and re-emphasize another point in terms of people getting better. One of the other benefits of having a PACE program like the Center for Senior Independence, sometimes you have that subset of the geriatric population where really they don't have a health care provider that's providing continuity of care.
Right.
To be seen in a doctor's office and then go into an emergency room and then end up in the hospital and then go to a nursing home, and each entity you're seeing a different physician. PACE eliminates that because there is a provider that provides continuity of care, and wherever that person is, that provider is going to follow them, and that also helps to improve the quality of life.
Wouldn't that be wonderful if that were the case? But it's not the case. I mean, in your particular...
It is the case for our program.
For you.
Yeah.
But, you know, people do wander around. They go see their nephrologist. They're on blood transference programs and things
the
such as that.
ophthalmologist for their eyes.
And the audiologist and things such as that. I mean, it's very tough for someone to lose their hearing and try to maintain their health and not give up. I mean, they need the courage to continue to improve their quality within themselves. I don't know, but...
And if we can make it more accessible for people, I think it makes it easier for them as well.
I'm sitting here listening to PACE for the first time in my life. I didn't know this existed. We're going to take a break. When we come back, I want to ask you a few questions, if you can answer, about Obamacare, because I'm clueless about that, and I think our audience might be too. We'll be right back on Due Process. Thank you.
Legal referrals and more information on this and other related topics are available on our website at www.dueprocess.tv. There you'll find information on today's program, helpful hints to legal issues, support materials, and lawyer referrals. You can also stream previous episodes of Due Process.
Okay. Well, at the break, we were saying that I wanted to ask you something about Obamacare. I know very little about it, except that it exists, it's going to be in place, or if it's not already in place. What can you tell me, Lynn, about Obamacare as it affects the Presbyterian villages?
Well, the good news about it is that everyone will have the ability to be covered. You know, also allow for portability from one plan to another if someone changes jobs. There's a lot of controversy about the pluses and the minuses of Obamacare, and there are some hidden costs that people weren't familiar with in terms of employers and citizens.
I understand that.
It is very complex. I don't know that anybody totally understands it. One more positive is that programs such as the one we've just been talking about have been a natural occurrence as we look at the entire healthcare system and the fact that it needs major change. So projects such as Rivertown, I think, are a part of this entire process.
Well, wouldn't it be wonderful to have this kind of facility available to all citizens at all times? And I don't know where you get the funding for that. But with Medicare and Medicaid, and they're eligible for that, PACE is saying we can make it work, right?
That is exactly what we're
now, keeping people out of nursing homes on a regular basis would be really important if you can sustain that. And I know that you would like to sustain that because our nursing homes they're filled up, I mean, with people. By the way, it's the families that need education. It's the younger parts of the younger people in the family that need the education, because they don't know what to do except try to put mother in a nursing home.
Yes.
And let someone else take care. When mother has the innate ability to function if she's given some assistance.
Right.
Exactly.
The largest difference between someone living independently and someone in a nursing home is education, choices, and the support system around them.
The quality of life.
The quality of life.
The quality of life would be important, but they say, well, can't handle mother, we're going to have to put her in a nursing home. So she goes to a nursing home, and then she dies. Because that's what happens. No one leaves the nursing home that I know of.
Yeah, and the choices have been limited. And again, that's one of the benefits of having PACE. In the past, a person reached a certain point, it was a point of no return. Their only options were nursing home, or in some cases, families literally gave up their jobs to stay home and take care of mom or dad, and that wasn't ideal either. So now there are choices, and one of the choices is a PACE type of a choice, because we have an opportunity to take the very same person that would have been in a nursing home, provide services, support the family, and give them a quality of life and maintain them in the community.
You mentioned that you were limited in numbers by the state. You can only have, what, 200?
Well, right now, they give us a number of participants that we can have at the one site. So that number is 230.
Just one site.
But but we're going to have a second site, and the numbers will be higher at that second site.
Lynn, you've been involved in this aging dilemma for how long now?
About 20 years almost already.
20 years.
So I'm with you. We're all aging. When I started this, I was planning for other people. Now I'm getting there too.
Oh, stop it. Doctor, how long have you been involved in this?
Well, I've been with the health system for 25 years, and of that 25 years, my interest has always been geriatrics. So I've been the medical director for the PACE program for approximately 12 years.
So I'm sitting here with two people with 45 years of experience in this aging issue. And all I can, and I love what I'm hearing that you're improving or attempting to improve the quality of life, knowing the inevitability for this patient.
Right.
Yes.
But that's a great thing. How do you, well, you were with the Michigan Commission on Aging, weren't you?
Well, actually, I was a commissioner first, and then I was director of the Michigan Office of Services to the Aging for 6 years.
How do we let people know that this PACE type of facility exists? How do we do that?
Well, we're working very hard to get the word out, all of us who are partners with Rivertown. One of the things we fight against is there's so much attention on other issues, and so people have selective listening. People fear aging in our culture, so they tend to not pay attention to it until mom falls or there's some dramatic thing going on. So we're working to do programs, and as you recall, I had my own business, Your Aging Well Advisor, which does educate folks on caregiving and aging well. Presbyterian Villages has acquired that business, and we're creating a subsidiary, which will tie in very nicely with what we're doing to educate the public.
How do we get the word out to the children of these people that they don't have to quit their jobs and take care of mom or dad?
Again, a lot of that really does have to do with education, and it may start from a community level, but I'm going to advocate for the health care side of this, and I think that even healthcare providers, physicians, nurses, social workers, that these people may come in contact with when somebody's in the hospital, when somebody goes to an emergency room. It's important to let them know that, again, there are choices, there are options now, that nursing home is not the only choice for an aging parent, but there are choices and there are options.
Right. So what I hear is that the doctors who treat, who are willing to treat these patients, are not going for the cure, they're going for the quality. Quality
of life.
Yeah, and is that how they're trained in medical school?
Well, I haven't been in medical school in about 35 years.
I know that.
So I'm going to say that I'm certain the focus has changed from when I was in medical school, and the focus really more is now on the whole person. We're not just treating a gallbladder or an eye or a knee. The focus really is on the whole person, and the emphasis now is on wellness, it's on lifestyle modification, and it's on aging well for everybody.
You know, I know there are a lot of physicians who refuse to go beyond trying to fix a lung infection. I'm talking about Mandela and his lung infection. They stop there. They don't go beyond that. And what you're saying and advocating is that let's treat the whole person emotionally, physically,
Absolutely.
and get to the family.
And I think as you see more and more of these partnerships attempting to prevent rehospitalization and having quality of life. So Henry Ford Health Systems is a partner in all of this as well. And you're going to see more and more of senior service providers partnering with folks like the Center for Senior Independence, Henry Ford Health Systems, other hospitals. Social media, I think, will play a huge role as well. We have a Facebook page at Presbyterian Villages of Michigan, which people can tap into to hear the latest or see the latest on issues. A website, doing programs like this is wonderful.
Okay, after all this time, are you satisfied we're making progress, Lynn?
We are making progress. We have so much more to do.
And Doctor, I mean, you see, I mean, you have a unique program. Now, you started where, on the West Coast?
No, well, actually, the very first PACE program in the United States was on the West Coast. It was in San Francisco, PACE Unlock, and that's where the whole concept of having a place where a frail, elderly population can go during the day and receive services started. So, yes.
But it seems so logical to do this. I don't know when the light went on in Michigan and said, let's do this. I don't know. See, hospitals are suffering, so they tell me, financially. They can't get paid enough through Medicare, Medicaid, or the Blues, or whatever health system there is. Is private health insurance available to be used at PACE or at your facility?
I'll comment on that quickly and then turn that over to you. For the most part, the participants that come into a PACE program are dually eligible, so they receive Medicare and Medicaid funds. For those who may not be eligible, for instance, for Medicaid, there is the opportunity to privately pay that. But when you look at the population that we service, for the most part, the average person could not afford to pay that premium, a monthly premium, which is what it would boil down to. So for the most part right now, we don't accept other third-party insurances. It's Medicare and it's Medicaid. And that may change.
And private pay.
And private pay.
And private pay.
Which can be expensive.
Expensive and few and far between.
I'd like to address, too, the financial issue for hospitals, because one of the changes that's been occurring at the federal level is hospitals are being penalized for large readmission rates. So there is financial incentive to partner and do these kinds of programs. So it's one of those things where the good news is what people want is what's less expensive and makes sense to do.
Well, what do you mean they're being penalized? I mean, is there someone in Washington saying you're not treating that patient properly or correctly?
Correct. They're being charged huge penalties and fines by the Centers for Medicare and Medicaid Services.
Is there some board of people who make that determination? It's a subjective determination. I don't see how they could do that.
Well, it's not so much subjective because it's off of the rates.
Yeah, exactly. And they're using a time frame. So what they're saying is there's going to be penalties for people who are readmitted less than 30 days. So you're in one day and then back in 5 days for the same diagnosis.
Oh, it's the same diagnosis. Okay.
Yes.
Then it's not subjective. I understand that.
Yes, there is.
I thought if a person,
there's a formula for it.
Well, I thought if a person was in for something and then came back for something else, that you're not penalizing them for that.
They're talking about what are called unnecessary rehospitalizations.
Well, you know, when we get to reading the Obamacare package, there is something about private insurance that employers who don't do it are penalized, who don't provide it are penalized, and some have chosen to be penalized because it's less expensive than providing health insurance. Then there's a requirement that people must maintain health insurance if they're employed. So I understand. It's not fully implemented yet, is it? I mean, we know bits and pieces of it. Some went into effect last month, but it's not. There's a screen up there, Michigan Office of Services for the Aging. They can go online, find your local area on aging online. And there we have Presbyterian Villages and articles and information. The Best of Aging, how's that?
That's a magazine that I'm a regular columnist for. Is available in many coffee shops and for free. People can also subscribe to it.
Do you go out to businesses and talk to these employed people and say your mother and father can utilize a certain service that you're not aware of? Do you ever do that?
Frequently.
It would seem that we can only do so many of programs such as this to get the word out, but it's an imperative because every day I hear stories from the caregivers where they abandon their patients in the middle of the night because they can't take it emotionally. It's very difficult. By the way, you mentioned you have hospice care, and do you provide that too?
We don't. We do partner with folks who do and refer.
Listen, my friends, I want to thank you so much. I think this is one of the better shows that we've done here to get information out. Good luck to you and your program. Good luck to you, Lynn. It's amazing that you chose to do this all these many years ago, and here we are living the problem.
Thank you.
Get online and do that.
Major funding for Due Process is provided by Meade Lexus of Southfield and Meade Lexus of Lakeside, offering a large selection of new and pre-owned certified premium vehicles.
Someday, your life will flash before your eyes. Make it worth watching. Introducing the 2013 Lexus LS, an entirely new pursuit.
And by WWJ News Radio 950, keeping you up to date with the latest news, traffic, weather, sports, and business information 24 hours a day, 7 days a week. Live, local, and committed to Michigan's future. News Radio 950, WWJ.